For sure. You know me, I'm always jumping down a lot of rabbit holes. So I really, really appreciate this guest coming on because there's quite the story to tell. And he had such a presence during COVID. Um, and this is and what the government is doing to him, and you're going to want to know his story and understand it and in some way help, because there are a lot of Americans that are still undergoing a lot of the tactics by the federal government. They can ruin a life in an instant for no reason. And when they come after somebody, I think the first instinct is to say, well, there must be something there. And that's actually not true, as we found. Look at Dr. Kirk Moore's case. I mean, all of these cases, these people that I interview, it's amazing to see what the federal government can do to people and get away with it on our tax dollar, because they win what 98% of their cases. And it is disgusting. It's disgusting legal system that we've got right now that's not getting fixed. And so I welcome to the floor, and I'm very excited to actually have you on the show, because I think that this is so important. But Dr. Ron Elfenbein, I really appreciate you coming on. Please tell people, because you were heavily, heavily awarded during COVID, which makes this even more amazing. So please tell people, and do not be humble, I'm begging you. Please tell people about your career. I want them to understand who you are.
Well, first of all, thanks for having me, Kate, and hello,
Sure.
everybody. I'm an emergency room doctor. I trained at Johns Hopkins, and became very active during COVID. I really stepped up and took my oath very seriously when COVID hit. So I owned an urgent care center, and we were seeing probably 20, 22 patients a day, something like that before COVID. And I recognized what was coming down the pike when Wuhan, China was being, literally boarded up and tanks were standing in the streets with the turrets pointed into the city. I knew it was coming to the United States. So I started to prepare as best I could by buying PPE and buying testing supplies, which positioned us to become the de facto testing site for my county in Maryland, and then pretty much the state, actually. We grew throughout the course of the pandemic. We grew from one site with about 4 employees to over 8 sites with over 300 employees within a year. And it wasn't, it was just because people just kept coming. I mean, our urgent care would open at 8 a.m. and people would start lining up to get tested at 4.
Wow.
And literally, we would have lines a mile long down the road outside the urgent care. I'm not exaggerating, over a mile long. We had to hire off-duty police officers to come in and navigate this because it was onto a major highway. So, I mean, there were just so many issues that kept popping up that it was just logistics like a nightmare.
Mhm.
Um, but we weren't out there advertising. We weren't pulling people in. They just kept coming because
Mhm.
the world was shut down and people were dying, and this was a global pandemic. So, we were trying to offer our services as best we could. And because I was able to secure all this PPE before that happened, before the world shut down, I was very generous with it. I was donating it to people. I sent it out to doctors in Connecticut and New York and other states. And actually, the DEA reached out to me, the Drug Enforcement Administration, at one point because they couldn't get PPE. And the special agent in charge of the local DEA office called me and said, "Hey, we need to do a drug bust. Could you please provide us with some PPE?" Which I happily did. I gave it to the federal government. And, I mean, we just kept growing and growing.
Mhm.
And we became, once monoclonal antibodies, which are basically the cure for COVID, once those became available, I was a very early adopter and proponent of them.
Mhm.
And I started speaking out on Fox News and Newsmax and Sky News and CBS and anyone who would have me. I was pretty much at least once or twice a week on the news, the
Mhm.
TV, talking about how COVID and talking about these wonderful cure, this monoclonal antibody, which is an infusion. It's just a bag of saline, basically, with the drug in it, which is a single antibody, and you infuse it into an IV. And this stuff was working fantastically.
Mhm.
I mean, so much so that people on death's door literally would be turned around within an hour or two of getting this medication. I mean, I've
Did
never seen
this
anything
work?
like it in my entire career.
Did this work the same for, say, flu, pneumonia, those types of things too?
No, no, because it's a single antibody against, in this case, COVID, and it was specific to the variants that we were seeing. So it wouldn't work for any other infection. But to your point,
Mhm.
monoclonal antibodies the technology is not new. So we've been treating other things with that technology for years, 30 or 40 years. It's
Mhm.
nothing new, and it's been around for a long time. Um, so I was talking about how wonderful these things were, and little did I know that because they were so effective, they posed a direct threat to the emergency use authorization for the COVID vaccine. And the Biden administration started to politicize it. They federalized the distribution. So if you wanted to get monoclonal antibodies, all you had to do was log in. The state would give you, if you qualified, the state would give you a PIN number. You'd log in and you'd order however much you wanted. They would send it to you. You'd have it the next day, and you could start infusing people.
Hmm.
But I'm an ER doctor. I don't know anything about setting up an infusion center. I had to learn all this. It was like we were doing it at uh, volunteer fire departments. We rented a couple of volunteer fire departments. There halls which weren't being used, and we converted them into infusion centers. And it was kind of like writing the playbook as you went, because there was no playbook on how to do this. And we became the largest supplier of monoclonal antibodies in the state of Maryland. We surpassed Johns Hopkins, we surpassed University of Maryland, and we were the largest supplier. And this stuff we were saving lives every single day. I mean, we were infusing over 500 people a week because the stuff was so wonderful and worked so well. And then the Biden administration decided to politicize it. So they federalized the distribution, and overnight that led to shortages. If you remember, Florida
Hmm.
couldn't get monoclonal antibodies, even though they were having a major outbreak. They could not get them because there was this artificial shortage.
Hmm.
So Ron DeSantis, the governor, had to go out and purchase them directly from the manufacturer. Then they started to use equity as a means, as a determinant for where they were going to send the monoclonal antibodies. That has never been done in the history of medicine. We've never talked about supplying medication based on equity before. It's always based on need. But now all of
Hmm.
a sudden, the Biden administration started to interject politics and say, well, we're going to send it where it's most equitable,
Hmm.
which just boggles the mind.
Yeah.
But anyway, I went on Fox News and I went on Newsmax and I said, this is silly. What are we doing here? This doesn't make any sense.
Hmm.
And then they shut the whole program down based on very spurious data that they were misreading to begin with. And I went on Fox News and I said they're going to kill people and they don't know what they're doing. And this is the height of bureaucratic arrogance. And 4 months later, completely out of the blue, I find myself indicted on healthcare fraud charges for patients I had never even seen. We had at our 8 sites, we had nurse practitioners and PAs, and they were seeing the patients. I spoke out. I exercised my First Amendment, right? And I was speaking out against the government who was politicizing something that shouldn't be politicized, that was saving people's lives. And they came after me for it. 4 months later, completely out of the blue with no warning. And they accused me of upcoding. These are the patient charts in my
Hmm.
hands right here,
Hmm.
5 counts of upcoding. And again, I didn't even see these patients. And um,
Wow.
the federal judge who adjudicated my case before even the trial said in a pretrial conference, he said, this seems like a case of shoot first and ask questions later, because they hadn't even gotten their hands on these charts before they indicted me. The government didn't get them until after they indicted me. And in order to know what the coding level is, you have to look inside the charts. But they
Right.
couldn't do that because they didn't have the charts.
And that was their main proof. That was their proof, right?
Well, that was their
Made up
right,
proof. Like that's
right,
what the whole
right.
case hinged on, right?
Correct.
Okay.
So,
Hmm.
they came after me for this. The AMA writes an amicus brief, which is a friend of the court brief, saying that the rules the government's accusing me of breaking, I didn't break, and the AMA is the one who wrote the rules. The American Association of Physicians and Surgeons wrote an amicus brief on my behalf, saying exactly the same thing. So the chief federal judge in Maryland
Hmm.
throws the entire case out in this 93-page opinion right here,
Okay.
93 pages, throws the whole case out and says, after a 3-week trial, and says, there's no evidence. I mean, I can just read you a couple quotes here. He
Hmm.
said, the evidence weighs so heavily in favor of the defendant that it would be unjust to enter judgment against him. Quote, the government did not carry its burden and no reasonable jury could have so concluded, end quote. I mean, it goes on
Right.
of 93 pages of this.
Wow.
And to your question before about awards, so the governor of Maryland personally gave me an award for all the work I did during COVID, a citation, personally handed it to me. The state legislature voted and also gave me a citation. And the
Hmm.
state medical society named me its person of the year for all the good work that I did during COVID and quote, your bravery.
Hmm.
And they named me its person of the year. And I got that even after I got indicted, which I think says a lot.
Yeah.
Um, So, the typically healthcare fraud is for billing for patients or things that didn't happen. But that's not the case here. All these charts were real patients who really got seen. The government acknowledged they got tested, everything was done appropriately. So, really, what this is a billing dispute at its worst.
Yeah.
So, if you want to, we build what's called a level four. The
Hmm.
government alleged that that was wrong. They never said why it was wrong, and they never said what the right level, quote unquote, should be. But if you want to say fine, so we were upcoding, okay? Of course I
Hmm.
wasn't, but if
Yeah.
that's the case,
Hmm.
the difference between a level four and a level three on average is about $50. Okay,
Hmm.
50 times five counts, five patients is $250. The government came after me for 50 years, 50 years in jail and millions of dollars in restitution, over $250.
Oh my gosh.
Yes. So for all the work I did during COVID, all the
Mhm.
hundreds of millions of dollars I saved the system by all the hard work that we did and all the people's lives that we saved and all the hospitalizations that we saved, they're coming after me for $250. So as they're packing their bags, literally putting the tape on the boxes, the Biden DOJ, they appeal. And now I'm facing a new trial in August because the trial the process had already started. So the Trump people come in, they have no idea what's going on. The case is just one of thousands of cases they already have in their queue,
Mhm.
and it's sort of just being pushed forward.
Is there
So
new evidence? How did they get away with doing
no,
this again?
no, it's just they appealed. So now there's a new trial. The judge, when he issued this 93-page opinion, said, not only am I acquitting him of all charges, but in case the government appeals, I'm guaranteeing him a new trial. He did both, which is very unusual. And 93 pages, by the way, in a judicial opinion, the Supreme Court very rarely writes 93-page opinions. So yeah, it's insane.
In your favor.
So
So,
yeah.
wow.
So Rod Rosenstein, who was the former Deputy Attorney General of the United States
Mhm.
and the former Maryland U.S. Attorney, wrote an opinion on the Baltimore Banner. He's not my attorney. I didn't hire him. He doesn't work for me. But he came out and said this case should never have been brought. This should send a strong message to the Biden DOJ that this kind of thing shouldn't happen. You shouldn't be tormenting people like this. So President Trump established the weaponization task force, and this is the memo from Attorney General Bondi, dated February 5th, 2025, where
Mhm.
she said she was setting up a weaponization task force, and on these people that they were looking at for weaponization, number seven is people who are whistleblowers. And I believe I fall squarely into that category. I am trying desperately to get a hold of somebody on the weaponization task force because I spoke my First Amendment right. I said the Biden people are going to kill people because they're
Mhm.
shutting this wonderful program down that's saving people's lives. The next thing I know, I'm facing 50 years in jail and millions of dollars in restitution for nonsense. And I'm desperately trying to get in touch with Todd Blanche. It was Pam Bondi, but she just apparently was just let go. So now I'm trying to get in touch with Todd Blanche because we've tried to get in touch with him. There's no website, there's no phone number to call, but I need somebody to get me in touch with the weaponization task
Right.
force because clearly this is weaponization of the government. We have the chief judge of Maryland saying that. We have the former deputy attorney general of the United States and Maryland attorney. We have the governor of Maryland issuing me an award and another governor of Maryland, former governor of Maryland, writing a letter on my behalf to the DOJ saying Dr. Elfenbein's a good guy. He didn't do anything wrong. This is crazy. And here's a copy of when I went on Fox News and I said they're going to kill people.
Mhm.
I mean, like, this is the United States of America. This stuff shouldn't be happening. You should be able to exercise your First Amendment right. And as a physician, I should be able to say I should be the one to make the decision with my patient, not the government, whether we're going to be providing this life-saving medicine or not. The Biden DOJ, the Biden administration had no right to do that, and they did. They politicized something that had nope shouldn't have been politicized, and it was really disgusting. And what I said in December of 2021 on Fox News, I would say again today, even though it got me in all this trouble, because I firmly believe what I was saying is true. And they killed people, and people were put in the hospital because of this. It's terrible.
Yeah, it is.
And I'm a whistleblower, and I think I should get in touch with somebody, or somebody should get in touch with me. The president asked them to provide cases. I mean, this is what the memo says:
Right.
go out and find cases exactly like mine and show it to us. And that's what I'm trying to do. I'm trying to get somebody's attention to say, hey, this is crazy. It's already been adjudicated. The judge threw the case out. Why are
Yeah,
we going through this again?
it's amazing. That is amazing. What do you think they were trying? I mean, why? What do you think, as far as what you said, go back to 2021, what you said that just obviously enraged them enough to go after you after $250 and false charges? What was it about what you said that would have gotten to them?
Well, I think it's two things. I think it's the fact that I embarrassed them, but more
Mhm,
importantly, according to Secretary Kennedy, he came out multiple times and has said that there's a little known federal law that when you have a vaccine,
mhm,
if there is another medication that's proven effective against the disease for which that vaccine is designed for,
mhm.
and it has an emergency use authorization, it will lose its emergency use authorization because there are alternative treatments,
So a threat to
which
that.
is 100%, which is why they destroyed ivermectin, which is
Mhm,
proven to be effective, and
mhm,
hydroxychloroquine. And again, this isn't me. This is Secretary Kennedy saying this. So yes, I embarrassed them. I made them look silly, and I said they're going to kill people, and that's bad. Okay, but
mhm,
beyond that, we were the largest supplier of this drug in the state of Maryland. The U.S. attorney in Maryland was brand new, had
mhm.
just been appointed by Biden, and they had this COVID task force out there that was looking for people to make headlines. And I was the perfect person to fit that. From I mean, from a political perspective,
Right.
obviously they destroyed my life and they destroyed my family's life. I have 4 kids. I have a wife who's a doctor. Like this has been the worst experience I could ever imagine going through. And I mean, I would put like loss of a loved one here. Just
Mhm.
below that is this whole
Yeah,
this nightmare that they put you through.
it
And
destroys.
yes, I was acquitted, but now I'm going to have to go through it again. And it's the process that's the pain and the punishment. It's not necessarily the end result. It's the whole punishment is the process.
Have you noticed that since that directive from President Trump, have they brought forth cases for whistleblowers? Have they been effective in doing that?
No, they have not, and which is why again I think they'd be happy to have my case. This would be a win for them. They would look at this and say, "Oh my
Yeah.
God, this is great."
Yep.
Like we got a guy
He
who's
was
being
acquitted.
prosecuted with, and exactly. There's a federal judge who wrote this ridiculous, I mean, ridiculous, this
Yeah.
incredible opinion, and we're going to save taxpayer dollars. We're going to save time. We're going to save this guy who look. I,
Mhm.
I don't mean to pat myself on the back, but it was a hero during COVID. I was out there. I didn't
Right.
see my family for 2 years. I was on my phone constantly because I was running 8 sites, and we were infusing people right and left that qualified because it was a life saving drug. I mean, and at worst, what they came after me for was a minor billing dispute over $250. And you're
That's
going to say I should be in jail
15.
for 50 years? And this has never happened before, by the way. This has never happened. No one has ever been prosecuted for what they're coming after me for.
Wow. So there's been a clear since 2020. I've noticed with all the people I've interviewed that we do like 300 interviews a year, and it seems to me that there was this very clear desire to end the patient doctor relationship. Like you don't have a relationship, the government gets to oversee your relationship. Do you agree?
100%. 100%. Yes.
Yeah, like there's
It,
an
and
annihilation of it. Yeah.
totally inappropriate and totally
Mhm,
wrong, and it's a total violation of not just the fact that you should be able to talk to your doctor and all the rest of that, but there's a reason for that. I mean, the
mhm,
doctor is look. There's lots of smart people in government, no question about that. But do you think the government knows best than the doctor that you choose to go see? You're seeking their advice. You want them to tell you what they think and what they think you should do, not some government bureaucrat. But
right,
that's exactly what happened. They took away people's informed consent when they shut this program down. And they, by the way, then they started to take the EUAs away from the monoclonal antibodies, the emergency use authorizations. And their rationale when they shut the program down in 2021 in December, and I called them out for it on Fox News,
mhm,
their rationale was, oh, there's an Omicron spike, and the monoclonal antibodies don't work against Omicron, which is dubious to begin with. But then
mhm,
they said once the prevalence reaches 70%, we're going to shut the whole program down. Now, number one, you don't know that the prevalence is 70% because we were only testing genetic testing on about 1% of people who got COVID swabbed. So
mhm,
you have no idea what variant the person who presents, if you're presenting to me and I'm seeing you as a
mhm,
patient, I don't know what you have. So why would the government take that right away from you, from us to talk
mhm.
about it and to say, hey, Kate, I have this medication I can give you. It might work, it might not, but there's very little to no side effects. So
Right,
why not try it? But
right.
they took that right away from people, and that is disgusting and that is wrong. And I will never forgive them for that because lots of people were harmed because of that. There's no question about it.
I noticed that when Operation Warp Speed was announced, that right after that, I think it was right after that, that there was an announcement that the government was going to take over basically three different areas, and one of them was going to be airlines. They were going to take a big seat in running the airlines, which probably people wouldn't know that was happening because it's still under the private labels of the airlines themselves. Also, the medical side, hospitals, care would go through lawyers. It would be AI'd at that point, but it would be government directives would then control the overall directives of hospitals. And then the other one I suspect would have been trucking and supply chains.
Hmm.
So in the event of that, and looking at what the government did to rush to judgment to procure this vaccine that I feel like with the evidence that's been shown that it was already being produced, so then they just slapped this label on it. There was a huge, obvious protective where this can be the only thing that works, this can be the only thing, and
Right.
there's a lot of money involved, and so it was a threat to that, I would imagine. So can you describe to people what this did, the medication that you prescribed, what did it do in the body that was so
So
different?
right. So the reason it's so effective is because
Mhm.
just an antibody is your body produces a protein, and it basically binds to the virus and binds it
Mhm.
up so that it can't infect you. What this is it's a single antibody cloned quadrillion times. Okay. So the
Okay.
bag that we're infusing into your arm is the antibodies that your body would produce, say, given 3 weeks. Okay, so if I infected you with COVID today, 3 weeks from now, you would have this great immunity to it. You'd have all these antibodies your body would have produced because your immune system ramps up. But
Mhm.
we're going to give that to you in one quick shot. It doesn't take 3 weeks, it takes 30 minutes. So it's incredibly effective and incredibly safe. But again, the government didn't like it. As you said, they wanted their narrative, which was vaccinate, 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 vaccinate. That was the
Mhm.
only acceptable treatment, quote unquote, and it wasn't a treatment for COVID.
Right.
Um, and I didn't mention this, but the government, actually, the Department of Health and Human Services, reached out to me and said, you're pretty good at this monoclonal stuff. Could you open up a site for us at
Really?
FedEx Field where the Washington Redskins play football? And I
Mm.
said, absolutely. So the government paid for everything in partnership with HHS and the Maryland Department of Health. The three of us, we
Mhm.
worked together. We opened up a monoclonal infusion site there. And I had to convince them to test as well because we could take sick people, test them,
Mhm.
and take them right from the positive test, put them in an infusion chair, and cure them same day. And they were like, "Oh my God, that's such a great idea." That became the blueprint for all monoclonal antibody infusion centers going forward. And that
Wow.
was my idea. And and it was very successful. But like, again, would you go into business with somebody you think is a fraudster? Right? I mean,
Right.
it's crazy. You can't
Yeah,
make this stuff
and then
up.
they turn around and prosecute you.
And then they turn around and prosecute me. Right. I mean, you cannot make this stuff up.
I
And
know.
I mentioned the five charts, right? So there were five
Mhm.
patients. We saw in that time frame of the indictment, we saw over 100,000 patients. Just to put this into perspective, the
Mhm.
government looked at five, and they didn't even look at them until after they had indicted me, kind of very Stalin-esque, like show me the man and I'll show you the crime. They looked at five charts. They never even had a professional coder look at the charts, just government attorneys. They never even hired a professional coder to go through the charts and say whether the coding was accurate or not. And they never said what was wrong with the coding, and they never said what the appropriate coding should have been.
Wow.
Like this, you sound like you're crazy when you talk about it, but
I
this is
know.
this is my reality. And we
It's
hired a professional coder. He went through hundreds of charts and said they were all appropriately coded. In fact, a couple of them were possibly down coded by accident. They should have been a level 5, not a level 4. And then we subsequently hired another coder to go through them and look at them, and he said the same thing. And these are people who are professionals. And the first guy was the former president of the American Association of Professional Coders. The second guy, the DOJ, the Department of Justice, hires him to train people to look for fraud.
my gosh.
And again, the American Medical Association wrote an amicus brief on my behalf that said that the rules the government is accusing me of breaking, he didn't break, I didn't break, and they wrote the rules. Like, you just cannot, you can't make this stuff up. and they're still coming after me. And again, I think this is a perfect case for the weaponization group, just to find out and say, look, this is crazy. Let's end
Mhm.
this guy's torment and let's end wasting taxpayer dollars.
Yeah, yeah, for sure. So I know in Kirk Moore's case, all of a sudden, certain people stepped in and it was done, right? So that could happen for you if maybe, I don't know what it took for Dr. Moore, because he was kind of looking at this very long sentence for not doing anything wrong. So what do you think could happen? I mean, if you can get a hold of the right people in this case.
Yeah, hopefully the same thing. I actually have become very good friends with Kirk
Mhm.
since this happened. I cold called him after I found out he was
Did you?
acquitted, and I said,
Yeah.
"Hey, yeah, I did. I called him,
Yeah.
and he was so gracious and so wonderful, and he's been such a good guy, and he's been so helpful to me." Um, but I was on another podcast a few months ago,
Mhm.
and you never know who's listening. And I say
Right.
that because I'm on this podcast with Mary Talley Bowden,
Mhm. I know.
and
Mhm.
um, a couple days later,
Yeah.
my phone rings, and the other person at the other end of the line says, "Hi, Doc, it's Senator so and so, United States Senator so and so. I saw your interview, and I want to help you."
Nice.
And I don't want to give his name, but
Mhm.
I mean, you never know who's paying attention. And I was in his office a week or two later with him and his staffers, and we were talking about my case. And I have another secretary of one of the cabinet members. Also, the general counsel called me because they want to help too. So the point is, you never know who's paying attention and who's watching. And if people could go, I have a website. It's www.dropthecase.com.
Nice.
If people could go there, I'd appreciate it. There's all kinds of information. There's a timeline. There's all sorts of stuff. And I have a give, send, go of people, because this has really completely destroyed our finances.
Oh, I'm
I
sure.
couldn't work for 2 years, and I
I'm
mean,
so sorry. What
yeah, it's been a nightmare. And luckily,
what's
my
the
wife, who's a doctor, also, she's a pediatric oncologist. She treats children with cancer. She runs the bone marrow transplant program at an academic center. I don't want to mention the name, but um, she's a professor there. And luckily, she's continued to work because I couldn't work for 2 years. And I mean, and I still owe my lawyers an ungodly amount of money. And it's still ongoing. They're still coming after me. They just will not let go.
It's amazing. I'm
Yeah,
so
and we just
sorry.
can't figure out why.
What is the protection over what they do. So so they don't want anyone contradicting what they want out. So out there for us. So what's your give, send, go? That way people can help.
It's if you just go to dropthecase.com, it's on the Gifts and
Okay.
Go.
Drop the
Or I
case.
have another website. It's www.ronelfenbein.com. My name.
If anyone out there has any contacts with Todd Blanche, I haven't heard great things about him, but if anyone has any contacts there, if anyone listening to this, please share this. And this will be its own podcast. I'll make this into its own podcast on YouTube, X, and Rumble and Facebook, so that people can share just this, so that people can help those that are just so unjustly gone after. And I after all these cases and all the people that have, and it goes right back to, if you do not if you present anything, any idea, anything that goes up against their big agenda, it just they'll just wipe the floor with you. And it just makes me
Yeah.
sick. They're using our tax dollars to do it, which means that they're going to win their cases most of the time, right? So
Yeah.
all so it's
And,
just thing.
and sorry, I was going to say, there's a guy, Kenneth Polite, who was on my indictment, and he's also the guy that Jim Jordan just named a few weeks ago as having signed off on all the
Wow.
subpoenas for all those congressmen. So, like, it's not just
Right.
me, right? I mean, he went after congressmen. He went. I mean, this can happen to people. Like, people don't think this can happen to you. It absolutely can happen to you. It happened to me. It can happen to the president of the United States. I mean, it can happen to anybody.
Yeah, I'm with you. I'm with you on this. Dr. Ron Elfenbein, thank you so much. I'm so glad you joined me for this. I really am. Thank you.
Thank you, Kate. Thanks so much. Pleasure.
Yeah, really appreciate you. It really is a crazy, crazy thing that's going on. And I feel bad for anyone that's undergoing this. You know, uh, everybody has different thoughts and feelings on what COVID was. I'm one of those that I have a lot of big questions about what it was, and even if it was. So COVID is a very, very interesting conversation to have in this day and time. And then also, anytime you pose a threat, right? to their agenda. And the agenda was, we don't want anyone going up against our vaccine, right? The vaccine that they already were getting prepared for, that they were already making, so they had enough doses in the time of toilet paper shortages, in the time where we didn't have any shortages in signage, right? The little bubbles that you had to stand on. We didn't have any shortages in vaccine materials. We didn't have any shortage in anything that they wanted to get out there via the government, oddly enough. But we had shortages in everything else. It was such a crazy time, such a crazy time. One thing I forgot to ask Dr. Elfenbein was when he was doing 500 a day, was that all very, very sick or very, very healthy, or a mixture, because people were just scared, so they wanted to get the monoclonal antibodies? But I will ask him, I will text him and ask him. But it does come back to money, and it does come back to agenda. Seems like every single time, doesn't it? Money and agenda. And yes, I agree with LB on you.